Prescriptions sometimes takes an unusual turn, and doesn't always lead to the pharmacy. These days, a doctor's note can take you to a virtual world, or even a fake surgery. Today we will be looking at the top 10 bizarre things doctors prescribe, instead of medicine. Number 10. Depression. In the United Kingdom, doctors can now prescribe books as means of treatment. Should a patient with depression need treatment, they can get a prescription paper from their physician for therapy. However, this ticket is not a backstage pass to grab any book. Given only to those with moderate depression. The titles are chosen by the doctor, and relate to self-help topics involving depression, anxiety, OCD, and diet. This will help sufferers to feel less isolated, and experience a solution providing catharsis. This method has been a success among children, and has a good track record. The therapy cannot cure depression on its own, but might provide an alternative to help manage the condition. Number 9. For mental and physical illnesses. In 2018, the Francophone Association of Doctors in Canada, MFDC, asked physicians a curious question. Would they treat patients to a museum as part of their treatment? Over 100 doctors signed up for the program. The unconventional initiative is based on evidence that visual art has a positive influence on health in general. A doctor will provide a free access card to the Montreal Museum of Fine Arts, MMFA. The prescription allows 2 adults and 2 children to visit the museum together. This is an additional perk. While the patient views the art, they can also spend some time with their family or friends. Being social in a safe space erases the stress that aggravates many conditions. Shepherding people into a museum as a medical treatment is a world first. Even better, the doctors can use this method for a wide spectrum of conditions, including trauma, anxiety, depression, epilepsy, and many more. Basically, most mental and physical patients could benefit from this program. Number 8. Burn wounds. Shriners Hospital for Children is one of the best burn facilities in America. They treat kids that arrive with terrible wounds, sometimes covering their faces, or as much as 70% of their bodies. Despite Shriners' excellent care, the strongest painkillers are not always enough. The pain experienced by kids is astronomically high. Hoffman is both a cognitive psychologist and the director of the Washington-based Virtual Reality Research Center. Hoffman and his colleagues came up with a novel idea. The human attention span is only so long, and pain requires a lot of focus. Theoretically, should a person get lost in a virtual world, their pain awareness should drop, as more brain signals are occupied with the false reality. Remarkably, it worked. The children's wounds prevented a fitted device. The game is called Snow Canyon, and features cute Arctic characters the player can pelt with snowballs. The children were so distracted by the igloos and floating along the canyon, that nurses could clean their wounds during the game. Indeed, their pain levels dropped by 50%. Number 7. Homelessness. Hawaii receives an annual medical allotment of $2 billion. A fraction of the population is responsible for draining the country's resource. Homeless people keep arriving at the emergency room with injuries, infections, mental illness, and the fallout of substance abuse. Their treatments are covered by the government, but expenses skyrocket because individuals often return within a week with renewed infections or complications. This recurring issue is due to living in unsanitary conditions or not having adequate shelter. On average, one person could cost the government $120,000 per year. Add that to the $18,000 required to give someone a home, and the answer seems obvious. In 2017, a radical bill was proposed. If homelessness could be classified as a medical condition, then doctors would be able to prescribe a house. Indeed, research has shown in the past that healthcare cost fell by 43% when the homeless people were given proper housing. Despite the savings and safety for the homeless, not everyone agrees with the bill. The Department of Human Resources Development fears it might be abused to get free houses, and could overwhelm the healthcare system. Number 6. Health management. After a successful trial run, doctors in Scotland can now legally release their patients into the wild. Since 2018, nature is an official prescription to help treat an existing condition, or to reduce the risk of developing a disease. These range from diabetes, cancer, high blood pressure, and stress. This may sound insane, but numerous studies have found that nature has a beneficial effect on the human mind and body. The program is called Nature Prescriptions. When a doctor decides a person needs it, they hand the patient a pamphlet explaining how nature is a powerful healing force. This calendar also highlights things to do at certain times of the year. During January, lichen hunting is recommended, and dogs are best walked in March. Other suggestions include cloud adoration, and hurling rocks into the ocean, after inscribing them with worries. Patients are also encouraged to use their imaginations when sauntering outdoors to soak up what nature has to offer. Hiking, listening to birds, or enjoying the wind, are just some of the options that could lower stress levels. Number 5. An addiction. In 2016, Canada's government passed an unusual law, giving permission to those addicted to heroin to be able to get their fix legally. There are serious rules restricting access to diacetylmorphine, which is the medical version of the heroin. First, a patient must have failed at every other conventional treatment. A doctor must then apply to the health department on behalf of the patient. Every case is judged separately, and should the person receive approval, the department provides the diacetylmorphine. The approach has two benefits. The drug methadone is normally used to wean patients off heroin. When compared, the statistics showed that more people were put off from the drug when they used diacetylmorphine than methadone. Those on methadone were also more likely to turn to other drugs. Secondly, the addict is monitored by medical staff during the heroin injection. This provides a safe and controlled space that otherwise could end with an overdose. In fact, Canada's rising overdose death rate was one of the reasons why the new treatment was embraced. Number 4. For mental and heart health. In 2019, Wales launched a pilot project to improve cardiovascular health. 2 medical centres in the capital of Cardiff has been authorised to prescribe bike rides. Not only does regular cycling cut the risk of dying from heart disease by 52%, but it also heightens the spirit. Needless to say, bicycles also do not contribute to pollution, like cars and buses. The health initiative allows doctors to give patients a 6-month subscription to a bike rental company found locally. In Europe, rented bicycles can cost up to £10, around $13 a day. This is not encouraging for those wishing to improve their health. The 6-month subscription allows anyone to zip around the city for free, without paying the rental fees. The program is the first of its kind in the United Kingdom, but could lead to bigger things. Should it prove successful, the UK plans to add more activities to complement conventional treatments. Number 3, let's go green together. The National Health Service, NHS, is turning people to green prescriptions. No, this is not marijuana. The term refers to bonding with nature to reap the medical benefits. However, in this case, the focus is more on community gardening. The individual can now experience less loneliness, anxiety, and depression. But what purpose does a bunch of gardeners serve together? A group project encourages better habits. One is more inclined to stay with a social project over time, foster a sense of community, and even walk more if the garden can be reached on foot. Since many community crops produce vegetables, people can enjoy fresh fruit and vegetables for free, or somewhat cheaper than going to the local shop. Planting and maintaining the garden also helps people to think and communicate better. A successful project can even boost the environment. Growing trees consume harmful emissions from the air, while also providing a haven for birds and wildlife. Number 2. Various conditions. In 2011, the German Medical Association gathered information about placebos. The report found that half of all German physicians prescribe placebos, and as many as 88% in some areas. Contrary to what one might initially think, the placebos included vitamin pills, homeopathic alternatives, and fake surgery. The study found that in certain cases, it worked. Not only did it relieve the aches and pains in patients, but when placebos were prescribed, it showed a spike in effectiveness. Interestingly, the success of a placebo was dependent on the way it looked, and how much it cost. The cheaper they came, the less effective they were. Patients also liked pills to come in certain sizes and colors. Injections proved to be the best. However, it was made clear that standard medication should never be denied, if a person's health might suffer. The association also recommended that doctors should be educated about placebos, and international guidelines should be drawn up to regulate their usage. Number 1. Bothering GPs. General practitioners are constantly burdened with patients making appointments for things physicians cannot help with, such as loneliness, welfare, housing issues, and many more. In London, almost every third appointment is non-medical. As a result, GPs are busy 24 hours of the day. This would sometimes lead to a burnout, and practices struggle to hire new doctors because of the workload. In London, Parchmore Medical Center tried something called community prescribing. The project, launched in Croydon, allowed doctors to prescribe things that got people out and more involved with their community. However, each person was allocated an activity related to their problem. People who were lonely would get a ticket for a bingo night or dancing lessons. There were 112 activities available, and during the 18-month trial, around 30,000 social sessions were handed out to patients. The results were promising. People became more social and connected with their community. GPs started working normal hours, and referrals from outpatients dropped by 20% in 2018.